That's 7. We have 7 members on.
Okay, I think Judge Phelps stepped away, Cindy. So as soon as he gets back, we'll ask you to do a roll call.
Hey, we appear to have a quorum. Cindy, you want to go ahead and do a roll call?
Yes, Judge Phelps,
Here.
Lauren Dyerhurt,
Here.
Jan Clark, Dr. Brian Dyer. I think she, yeah.
Yeah, he's trying to get on.
Yeah. Dr. Robert Flowers Sr., Tabitha Shelton,
Here.
Kristen Branham,
Here.
Gary White,
Here.
Mike Morgan, Mike's on there. I'm not sure if he can hear me. Dr. John Stevenson,
Present.
Jenna Shea Watson, and Doug Williams. Doug's trying to get on. He said he's asking him for an ID, but it should let him straight in.
Let me look and see if I can find the ID.
We have a confirmed quorum of 7. Let's go ahead and while the rest are getting on, let's have a word of prayer, please. If everybody would bow with me. Dear most kind, gracious Heavenly Father, Lord, we come to you with praise and thanks for this beautiful day that you've given us, dear Lord. We thank you for the sunshine that you've given us here in the middle of winter, dear Lord, and just so appreciative for that. Thank you for all the blessings that you always bestow upon us. And thank you for your love and care and kindness, dear Lord. Lord, we just ask you to be with us in this meeting. The Cumberland County Health Department, dear Lord, just be with us and watch over us and direct us, and whatever business is done, dear Lord, we just pray that it'll be pleasing to you and in your will. Dear Lord, I just ask you to keep a hand on our healthcare workers, our health department workers, and all healthcare workers, dear Lord, as we continue to battle this thing called COVID, dear Lord, just ask you to protect them all as they lend help to others till we get past all this illness, dear Lord. Lord, we thank you for your son, Jesus, dear Lord, and plan of salvation for us all. And all these things we pray in Jesus' name. Amen. Y'all want to mute, or I'm going to stand and do a pledge to the flag, and we'll carry on. Pledge allegiance to the flag, United States of America, to the republic which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening, everyone. We'll now call to order its regular scheduled meeting of the Cumberland County Local Board of Health annual meeting this Monday, February 7th, 2022. It is 6:07 p.m. This meeting is being done via Zoom. It's my understanding, Ron, that it is being broadcast as a public meeting as well. Is that correct?
That is correct.
Thank you all for attending. I know everybody's been very, very busy, and just so you get busier as time goes on. But thank you all for being here and helping have a quorum this evening. But if there are no objections, we'll move on with our agenda. First on the agenda is the approval of the minutes of February the 15th, 2021 of last year's annual meeting. Hopefully you all have had time to review the minutes. Does anyone know of any additions, deletions, or corrections to the minutes as they have been presented?
I'll make a motion that we accept the minutes, John.
Got a motion by Gary White to
I'll
accept the
second
motion
it, John.
as presented. And who was the second?
Doug Williams.
Doug Williams. Didn't recognize you number there, Doug. Thank you. Minutes have been properly moved and seconded that we approve those as presented. All in favor signify by saying aye.
Aye.
All opposed,
Aye.
like that. Motion carries. Minutes will stand as presented. Old business. What old business do we have to come before us this evening? Anyone have any old business that needs to be discussed?
I think Mr. Crabtree usually took this opportunity to ask you all if there was anything that any of the health department staff failed to follow up on, or that you all need us to follow up on for you. I'm certainly willing to do that if you all have questions or comments or anything that we can do for you, or something that you asked us to do that we didn't. We can include that here, I think.
This is Amy's first meeting as director of Lake Cumberland District Health Department. And she's doing a fine job since moving into that position.
Thank you, sir.
Okay, well, hearing no old business, new business. Is there any new business that needs to be brought before the board this evening? Quiet bunch this evening.
I know we have the business of setting the tax rate and approving our budget, but that's the next item. So I don't know if there's anything else.
We will move on. Guess we kind of need to do those together. I think in your packet, I think we've got a couple of different scenarios for the tax rate assessment for 2022. Amy, would you like to elaborate on them, where we're at now and what's being presented here?
We're going to actually, Ron is going to take the lead on the financial presentation, but we're going to do it together. We're going to set the tax rate and the budget, kind of have that discussion together. And this is the way I understand that you all have done this in the past, because you want to see where you're at financially before you decide on where to set the budget and where to set the tax rate. So you'll know where to be. So Ron, go ahead if you don't care. And if there's anything you need me to chime in on, I'm more than happy to.
I will share my screen. Can everybody see that screen?
We can.
Okay. So I can get my, there we go. So we are going to present the budget first, since it will show the varying rates presented in different columns. As Amy was saying before, we do this first so you can see how the rates are going to work through your budget to see how your outcome is going to be. And then, of course, after the presentation, before you approve the budget, you will need to actually approve a tax rate first. So in starting with the balance as of December 31st, 2021, you had $111,184.65 in your checking account. You currently don't have any CDs or anything. That would be the capital fund column. We always leave it there in case y'all decide to ever do that. We have projected tax receipts remaining for the rest of the year of roughly $133,063. That, of course, is made up of your real estate, motor vehicle, and your tangible or personal, whatever you want to call it, property taxes that are combined, making up that number, and a little bit of interest from your checking, giving you a total remaining receipts estimation of $133,091, giving you a total funds available before remaining expenditures for the fiscal year ended June 30, 2022 of $244,275. The remaining expenses that are projected are the second half of the LHD operations tax assessment fee, but which is your fee to be, of course, to be part of the district of Lake Cumberland. The first half was already paid out in December, so this will be the second half that will be paid out sometime around May. The advertising and printing, keep in mind as I go through these, the remaining expenses for the most part are the budget amount we did for this year into June 30, 2022, the year we're currently in. Less expenses we've already that we've already spent through December 31st of 2021. So of course, as you guys remember, we don't always expend all these expenses. In fact, there's usually a chunk left on the table, depending on how the year goes, whether we got to replace units or do anything with our building or things like that. So as I'm going through these, you'll see some sizable numbers. We may not be spending all that, but that's what we budgeted to just in case that we ran into some problems. So we have remaining advertising expenditures of $276. Remaining professional services. We did already have the audit, but we have not. We didn't actually pay that until January, so that's why you didn't see it reflected through December 31st, 2021. $8,500 left in maintenance and repair. $1,215 left in dues and subscriptions, which is your normal dues, KPHA, Calbo, all those things. Your board expense and your other miscellaneous. The reason that one's left over is as you know, we normally spend that for food and everything for these board meetings. Hopefully we'll get back to possibly doing live meetings at some point in the future, but obviously we're doing all these on Zoom again with everything going on. So there's not much board expense to spend this year. So I don't project spending that much the rest of this year. The furniture and fixtures, projected to have $5,500 more spent, and equipment of $12,439, with total estimated remaining expenditures of $88,332 for the year for this year ended June 30, 2022. That'll give you an opening balance for the budget I'm about to present for budget year 2023 of $155,944. For the budgeted receipts for this upcoming budget, I'll work my way down the page here. I'm budgeting 114. We're budgeting 114,200, and I'm just going to present, just so we know, I'm going to present this middle column here, this proposed budget at current rate, because this is the rate y'all have been using over the of the last so many years. All the expenses and everything you'll see will match in these categories. I'll show you when I'm done here the other two rates in more of a summary form, but I'm going to present in more detail just this first column here at the current rate. At the current rate of 0.035, your projected real estate property taxes are $114,212. Your personal property tax is $15,814. Your motor vehicle of $14,984. Where those numbers come from, and I think Sean told y'all this before every year, and I'll scroll down really quickly. This is the local assessment. This assessment for local we get every year from the state. That they get from the Finance Administration Cabinet, and they upload for us to use the numbers for what was turned in through 2021. We take these numbers for all the real estate, tangible, and motor vehicle, and we plug them into our calculation, projecting how much money that we're going to get in taxes, and we've always based that on a 95% collection rate, assuming that, you know, here and there you may not be able to collect all those taxes, and because normally we rarely would collect 100% of the taxes. So I'll scroll back up. That's where we get our numbers all through here, and all that is reflected in your packets. We project delinquent tax collections that we get throughout the year of another 3,000. That's kind of random. Every year we really don't know exactly how much we're going to get. There's no really method to the local government's madness on the delinquent tax. Some months you might get $300, some months you might get $50. It really just depends on various things in there. So it's not easy to project the delinquent tax, but normally you guys range from about $3,000 to $6,000 a year based on prior years. Your other taxes would be your telecommunications tax. We project that to be about $450 for this upcoming budget year. And interest, once again, small amount from the checking account funds that we have. Leaving you a total budget receipts of $148,524 and total funds available before expenditures for the upcoming budget year of $304,467. The budgeted annual fee, once again, to be part of the district is $122,113. That's based on 2.8%, 2.8 cents per hundred. We are estimating these are pretty normal recurring expenditures. I think we raised the snow removal a little bit because we're starting to find that salt's a little more expensive. The labor involved is going, a lot of things are going up as everything else is. So we raised that a little bit to $1,500 for snow removal and landscaping. We budgeted $1,500 for exterior building wash this year. You'll see in a second following the packet that there is some numbers backing these things up. We are showing we need a parking lot resurfacing. If y'all have questions about that, they can be directed towards Cindy on why we were needing these things. And I'll quickly show you two of the quotes. The exterior clean. This is for the exterior wash. We got that. We got projected 1,000. Of course, we'll probably get 2 more quotes before we do that. But that gives you an estimate, and we always want to cushion that a little bit to make sure, just in case something happens and there's some more expenditures that are not seen, so we don't have to have another meeting. So we put that at 1,500. And here was the estimate for the parking lot resurfacing. As you'll see, a 15,400. Once again, we always put like a little bit of percentage of padding there to make sure, just in case they run to unforeseen things, to make sure we don't have to have another budget or another special call meeting. That's where we get the 17,000. And we always budget a chunk of miscellaneous expense in each of these categories. For the building maintenance and repair miscellaneous, we're budgeting 14,000. That's to cover if you have a roof leak, or you have a bad plumbing issue, or the big one would be the HVAC. If you have an HVAC go out, 1 or 2, we normally try and budget in case 2 go out. So that's why that's such a sizable number. Furniture, moving on to furniture and fixtures. We budget this year, we budget 3 office chairs needed for $500. And once again, a little miscellaneous expense to cover any unforeseen furniture that needs to get replaced at $3,000, totaling $3,500 in furniture and fixtures. And then equipment. A couple of years ago, we decided to create a new category called miscellaneous computers and related equipment. That's basically any type of computer equipment like printers, fax machines, laptops, or anything related to computer equipment. We budget $7,500 in that. If y'all remember, y'all have an automatic generator now. So for a annual inspection of the generator to check on its fluids and to do any maintenance on it, we pay a little under $500. But once again, just in case there's a repair needed or something, we put a little more padding in there. So for $500 for that. And then miscellaneous. So you may ask, why do we have 2 miscellaneous computers? Well, one of the miscellaneous categories is just computer related equipment, like we discussed. This $5,000 of miscellaneous is more like if we need to buy like a refrigerator, like a medical refrigerator, or some kind of piece of equipment that's not really computer related, some kind of medical machine we need for the nurses, or something like that. Would be what this extra amount is. And since we don't do that as often, we make that less of an amount. So total equipment being $13,000. You guys will not need another audit until 2025. So we didn't budget any costs there. Your advertising and printing will be $300. We budget dues and subscriptions. This is pretty normal. Calbo, SPGE, and KPHA, $1,500 total. And once again, if we're able to have a board meeting, we budget next year live for food and everything, $500 for board meetings for miscellaneous expense. That is your total budget expenditures before optional expenses of $174,913. That would leave you with a cash balance of $129,554, with a deficit projected of $26,389. Now, keep in mind, we're having a $17,000 non-recurring parking lot expense. That's partially causing this. And also remember that normally we don't hit a bunch of these numbers that we're budgeting. So anything that you don't hit miscellaneous goes back into your budget for the next year. So there's more, there's a very good chance that this will actually finish anywhere between $10,000 and $15,000 better than what it's showing on the budget. So, and then there is a water bottle that they have asked, and this is why I put under optional. The Cumberland's asked for a water bottle filling station for $2,000. If you accept the optional expense in the budget, whenever we do that, you would need to motion for both. With optional expenses, it'd be $176,913, leaving you a balance remaining of $127,554, with a net surplus deficit of net deficit of $28,389. That is the current rate as presented. Whenever we, as you can see, I gave you a rate for break even with the same numbers, and with you would need a rate of 4.2 to break even with all the expenses budgeted that we proposed, and a 4.9% to we show a surplus budget too if you want to show a surplus with all the expenses, showing at 4.9%. That is the budget as presented. I'll leave this open now for y'all to discuss the tax rate.
Okay, you all have seen the proposed budget and proposed tax rate. We'll open the body up for discussion. Of course, a lot of that expense would be for the parking lot, as Ron explained. One-time occurrence for that. Then, of course, the optional water bottle filling station. Any comments or questions?
Hey, John, in the past, did we just use like the break-even tax proposals? Is that what we've done in the past?
Yeah, we've always tried to stay pretty close to that. So, I mean, it's changed very, very little over the years. We've been at that 0.035 for a pretty good while now. That'd be a correct statement, Ron?
I don't know how,
Yes,
I don't know how far back before me, but it's been here since I've been here. I've been here now for going on 4 years.
Yeah, I mean, I don't think we changed it in quite some time. We've been fortunate to keep it where it was. Ron, of course, if we make this increase, I guess at some point we'll have to have a public hearing. Public address, that's correct? I mean, that'd be more than a 4% increase, I assume, right?
Yeah, if you did want to increase, however, like I said, once again, I'm gonna suggest, and this is of course up to y'all. Like I said before, if it wasn't for the one-time cost, and I am gonna scroll down here really quick just to show y'all something. If it wasn't for the one-time cost, y'all would be just fine as normal. Okay. So this is a really good thing I put together. If you look at Cumberland right here, this is all our counties, but Cumberland, if you look at the trend of surplus versus deficit all the way back to 2013, you'll see that most years you surplus. Okay. So you're even this year, as I'm going to present to you later, you surplus at $23,451. Okay. So your current rate technically is fine. As I said before, that you probably will be in a deficit just because this year, just because of that fee, but it more than likely will not be a $26,000 deficit. My guess is more along the lines of a $10,000 deficit, 5 to 10. And you can certainly withhold your own at 3.5. I would definitely, if you did raise it, I would definitely recommend not raising it at the break-even part we did. We just wanted to show you that in case you want to. Of course, that's up to you as the board, but I am showing at your current rate at 3.5. Y'all, that rate is still sufficient, I believe, to hold your normal expenses.
Okay. Thank you for that explanation. Any comments? Well, after that, would anyone like to entertain a motion that we leave the rate at the current rate?
I would.
Got a motion by Doug Williams to leave the
I
rate.
second it.
And got a second by Dr. John Stevenson. Is there any further discussion? Hearing none, All in favor, signify by saying aye.
Aye.
All opposed, like manner. Motion carries. Now we'll need to approve the budget as presented based upon that tax rate. Would someone like to entertain a motion to approve the budget?
I'll do that again, John.
Hey,
Motion
Doc, Judge Phelps,
You made-
sorry,
Go ahead,
but there will need to be a motion to accept the budget with or without the optional expense.
Okay, all right. I think Doug Williams was in the process of making a motion to accept the budget as presented. Doug, is your motion to include the optional expenses at the bottom there? The
Yes.
water?
Yes.
Okay. That's Doug's motion, and his second is by who?
I'll second it, John.
Seconded by Gary White. Now, is there any further discussion? Hearing none, all in favor signify by saying aye.
Aye.
All opposed, like manner. Motion carries. Bronze, I got everything taken care of on that part for now, for the time being.
Everything's good on the budget. And good news is, guys, is this year you will not have to sign that ugly tax. You will have to sign something. I think one document from Amy, but from the tax rate, you will not have to sign that 12 board member packet for the tax rate this year.
Oh, okay. I forgot about that thing. Okay, we'll move along. We've got several members whose terms are subject to expire December 31st, 2022. Kristen Branham, Jan Clark, Dr. Brian Dyer, Dr. Lauren Hurt Dyer, and Tabitha Shelton. We have part of those folks on the call. Looks like with the exception of Jan. Are all of you all willing to serve another 2-year term, or can they all serve? Are they all good to serve another 2-year term, correct?
Yes, they are permitted to do so if they choose.
Okay, got a thumbs up from Dr. Dyer, Dr. Brian Dyer.
Yes.
And Kristen Branham, yes.
Yes, for me.
Yes from Dr. Lauren Dyer Hurt. And
Yes,
is that
for me
yes,
also.
okay. All right. We got 4 out of 5 that are willing to serve again. And I guess we can check with Jan a little bit later on. We need a motion and second to renew these members for another 2-year term. Would someone like to make that motion other than those on that slate?
John, I'll make the motion. I'll second it.
Motion by Gary
Oh,
White.
Doug, got me kicker.
Motion by Gary White, seconded by Doug Williams. Now, if there's no other discussion, all in favor signify by saying aye.
Aye.
All opposed? Motion carries. Welcome back aboard come January. All right, next is our election of officers and a selection of a member to serve on the district board. We'll open the floor up for the office of chair for the board. Do I hear any nominations for the office of chair?
I nominate John Phelps.
I second that.
You're all in a hurry this evening. Are there any other nominations?
I move nomination cease.
I second it.
Get it done.
Good
They
luck,
have
John.
that planned.
It's
I
just
think they
one
have that
meeting a
planned,
year,
John.
so we got a pardon. Got a motion. It's been properly made, second that I continue to serve as chair, and then motion to nomination cease and be elected by acclamation. All in favor signify by saying aye.
Aye.
All opposed, like manner. Hopefully we had enough ayes there. I'm not sure if it's pretty quiet. Okay. I think we've got, is there another, what other officers do we need to select?
We have a vice chair position,
Okay,
and then we also have a secretary that used to be Mr. Crabtree. And I'm willing to continue on in that role if you also choose, merely so that we could do some signing of contracts and handle business on behalf of the board. That might be easiest. So it's your all's preference, whatever you decide on the secretary, but the vice chair also.
Okay, we'll open up the floor for the position of vice chair. And that is currently
Gina Shea Watson.
Gene Watson. Okay, that's what I was thinking. Miss Gina has been for a little while. Okay, the floor is open for nomination for vice chair.
You think Jenny Shea want to keep that?
She typically makes these meetings, most usually. If we'd been in person, she might have been there. I'm not sure why she couldn't make it this season.
She had a meeting or an appointment out of town today, and she wasn't sure if she was going to make it back in time.
Okay.
I'll make a motion to keep it.
Got a motion by Gary White that Gina Watson continue as vice chair. Is there a second to that motion?
I'll second it.
Second by Doug Williams. Are there any more nominations? Or any more nominations?
I'll make a motion, nomination cease.
Got a motion by Gary White for nominations to cease. And I suppose
Second.
elect her by acclamation. Second by Doug Williams. All in favor, signify by saying aye.
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 Any opposed? All in, motion carries. Watson will continue to be vice chair. And now the floor, we're going to open the floor up for nominations for secretary. In the past, let me explain. Sean Crabtree, the former director, filled that position, and Amy is willing to carry that out as well. The floor is open for nominations.
I'm good with nominating Amy as secretary.
Got a motion by Doug Williams to nominate Amy Tomlinson to be our secretary on the board. Is there a second to that motion?
I'm gonna give some more members a chance to make a second. I'll wait.
Me too, Gary. They're gonna think we're the only ones here.
Go it.
Y'all have this plan.
Gotta be
Gary
fast,
White.
Kristen.
I'll move the nomination cease. He win by acclamation, John.
Okay, you seconded it too, correct?
I second it, correct.
Okay, Gary White has seconded it. Now he's made a motion for nomination to cease. And Amy be elected by acclamation. Is there a second to that motion?
I'll second.
Second by Kristen Branham. All in favor, signify by saying aye.
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 All opposed, like manner. Motion carries. Now, Ms. Kristen Branham, I believe you've been our selection to serve on the district board. That be correct?
Yes.
Been a while since we've got together. We do a lot of Zoom things anymore. It's hard to remember.
Yes.
Things are starting to get hard to remember, so we don't get together much. Kristen, you willing to continue to serve in that capacity?
I am, unless someone else is just itching to do it.
Okay, are there, Kristen's willing to continue to serve? Are there any other nominations for that? Or interest? What are you saying, Gary? You want to make
Crickets.
a motion or you
I'm
interested?
trying to give somebody a chance to make a motion and stuff. Nobody
Me too,
speaking up.
Gary. I'm trying to be quiet.
I'm telling you, yeah. I'll go ahead and make a motion.
Okay,
I'll
got a motion
second
to
it.
Gary White,
I said,
seconded by Doug Williams. Think, I'm gonna give that to Mike. You come in there, Mike?
I think that was Dr. Stevenson.
Dr. Stevenson, okay.
Yeah.
Dr. Stevenson seconded. I'm trying to watch this green box. Everybody else is so quiet. I'm gonna give Dr. Stevenson a second on that motion. All in favor, signify by saying aye.
Aye.
All opposed, like manner. Motion carries. Okay. Next is our June 30th, 2021 financial statements. Looks like an audit. Been made part of your packet.
I believe Ron has gone over part of this already, mentioned some of this with you on where things were as of December at least, but he went ahead and hit the high spots of what was projected for the rest of the year also. So, Judge, if it's okay with you, I'll just ask him to finish up with audits and the rest of his financial report.
That will be great.
And once again, I'm going to share my screen. Can everybody see the screen?
Yes.
Yes.
Okay, so this is the first year, at least since I've been here, and based on me looking at prior reports, the first year we've really shown the financials at this meeting. I'm starting to do this because we used to send out the financials around October, November every year after we completed them for the prior year to all the board members, whether we mailed them or emailed them, whatever. I thought it was a lot smarter to actually include them to where y'all get to see them in a board packet. So you get that done. You actually get to have a copy in hand, and you get a presentation in case you have any questions. So I'm going to start doing that every year now. I won't take much time on this. I know you guys are probably getting tired of hearing some of these numbers, but I did want to see the picture from last year. So last year we had receipts of all these various categories here between real, tangible, motor, delinquent. You can see all these on the screen. I'm not going to go through all of them. Total receipts of $149,760. And looking through all these expenditure categories between advertising, the management fee, the categories we've gone over time and time again for the supplies, dues, and subscriptions, totaling $126,309. So in a second, I'll show you a screen that shows the budgeted to actual, and see how you came out this well, giving you a surplus of about $23,451, which I'll show you again in just a second. Moving on really quickly to the balance sheet. You'll see your balance sheet. You ended at June 30, 2021 of this prior year at $161,006.32. So you're doing just fine right now on cash. Moving on, here is the budget to actual, the one you're probably a little more interested in. I'm not going to go through the revenue categories. Basically, in each revenue category except one, we actually outdid the budget. So that's good. We received more when we thought we were going to in budget. And on expenditures, we in every category we either broke even or we surplused in. So we did really good, and that kind of relays what I told you before, that a lot of times the picture's better. It's when we have a bad year, we have a horrible roof leak or a horrible HVAC year, or we had to buy some big equipment like medical fridges, big printers, things like that. When you have big years like that, that's when you'll see closer to break even or even a deficit. But those don't happen every year. Sometimes those rains it pours years happen, usually just annually or maybe once or 1 or 2 years. But then I'd say more of the norm is going to be a slight surplus for you in doing that. But we have to plan for those bad items to happen. But you did finish this year with a $23,451. And once again, that is the individual breakdown of each category of how you did. That is the presentation of the financials. If there are no questions, I'll go into the audit real quick, which I won't spend hardly any time on because it basically reflects the financials. So moving on to our audit, I will show you 2 important points from the letters that were written by the auditors. And we use RFH. We've been doing that for a while now for audits. They do a really good job of doing health department audits. And it was y'all's turn this year. Y'all do an audit every 4 years. It's required by to be a special purpose taxing district, to be part of the special purpose governmental entities. We are required once every 4 years to have an audit. And it just so happened that 2021 was your year. So you won't have one again until 2025. I do want to show you, if you look on the page I'm about to show you, The auditors tell us in this paragraph right here under unmodified opinion on regulatory basis of accounting, says, in our opinion, the financial statements referred to above present fairly in all material respects the assets, liabilities, and fund balance of the Cumberland Public Taxing District as of June 30, 21, and the respective revenues and expenditures for the year then ended. So we have a clean audit, what we call a clean audit. It means we got a good report from the auditors in regards to our financials. They also comment on how we comply with government auditing standards. So I'm gonna go to that. As you can see, they go over our financials, which match exactly what I showed you a second ago. They leave us some notes, talks about how we were, as usual, talk about how we were set up as an organization, how we're set up financially, talks about how we are a taxing district and what that represents. These are all normal notes they leave. Talks about a little further detail of our cash, whether we're over or under collateralized. It says we have related parties, but the only reason we're related parties because you're part of a district, so there's nothing big there. They did add a note the last couple of years talking about the COVID-19 pandemic. I will read that real quick. It says, since early 2020, the COVID-19 pandemic forced certain restrictions in the U.S. and the state of Kentucky. The economic impact of the pandemic could result in a negative impact in the district's revenues. It really did not in Cumberland's case, so that's good. The duration and pervasiveness of the pandemic are uncertain as of the day of these financials, and the taxing district is continuously evaluating the impact of COVID-19 on its operations and finances. So they're starting to add that to all of their notes on when they audit health departments. This is the one I was talking about a second ago, where they assess how good you are in relation to, I lost it, sorry. Your internal control or financial reporting in regards to government auditing standards. Under compliance, I'll read this last sentence. The results of our tests disclose no instances of non-compliance or other matters that are required to be reported under government audits. So once again, for financials and for government auditor standard purposes, we are clean. Cumberland County had a clean audit, and that is good. Is there any questions for the financials or the audit?
Okay, you have heard a review financial statements through June 30, 2021, as well as the audit of said statements. Are there any questions? Hearing none, do I hear a motion to approve the financial statements presented and the audit and accept the audit?
Motion.
Got a motion by Kristen Branham. Is there a second to her motion?
I'll second it.
Second by Tabitha Shelton. Are there any further questions or comments or discussion? Hearing none. All in favor signify by saying aye.
Aye.
All opposed, like manner. Motion carries. Director comments. Amy, the floor is yours.
Thank you, sir. I appreciate that. Just wanted to introduce myself. I think many of you know me, but there may be some who haven't had the opportunity to meet me yet. With COVID, I haven't got to do as much travel around the district as I had wanted to early on to meet the local boards and to talk to some of you all. So I do apologize for that. I've tried to be in communication with you through email and through the office managers in different ways. So I am Amy Tomlinson. I have worked at the health department for over 17 years. I became the director last summer when Mr. Crabtree stepped down and started his retirement. The board appointed me, I think it was the 14th of June, and then Mr. Crabtree's last day was the end of July. So that actually allowed us 6 weeks or so of overlap to kind of work together and train and to just smooth the transition a little bit for me. Of course, then I took effect on August the 1st as my first full-time day as director solo. And that was about the time that Delta variant of COVID hit and everything went haywire. So it's been one thing after another since I became director. It's never a dull day. There's always something going on. You all know very well at the local level how the toll that COVID has taken on everyone. I cannot say enough good things about the Cumberland County staff down there. They are rock stars as far as how they've handled this, the amount of work they've put in, the vaccination efforts they've done. Just, it's beyond belief, the amount of work that has come out of that little bitty office. When you look at the size of our district, Cumberland County is one of our smaller counties, and I'm just so proud of them. The work that they're doing, it's by no means small effort out of that county. So they have worked over and above and beyond, just gone crazy with the amount of work they've produced out of there, and I'm so proud. Could not have done anything without them. Across our district during COVID, since the beginning of the vaccination efforts, the health department as a whole has done between 35,000 and 36,000 vaccinations. Doses administered, that's not full vaccinations, that is just doses administered. There may have been someone who came in and got one dose, or there may have been in those doses that may be someone who's fully the complete series and boosted. So it runs the gamut. I looked at the vaccination numbers before we came online tonight, and Cumberland County is sitting at around 47% vaccinated for the county as a whole. We would really like to see that number improve and go up, but at this point in the game, I think it is what it is. And of course, I'm hopeful the natural immunity offers something. And, with the surges that we've had, natural immunity may be the way that we're going to get past this too, aside from the vaccination efforts. The health department got behind on reporting some of our numbers right around the first of the year when the Omicron variant hit. Our cases just surged exponentially. It was unlike anything we had seen before. It was unlike anything with Delta or the Alpha variant or the very first ones, any of those others. So we went from having, less than 100 cases a day to having 600 or 700 cases a day. And we got behind very quickly. So between the closures for the holidays, we did have New Year's Eve and New Year's Day off. And then we had Martin Luther King Day in January that allowed staff to not work. We always give staff the option if they want to work, we're willing to pay overtime and do that. And a lot of staff do, but we don't have a full crew working on those days most of the time. So we got behind with some of that. And then we've also had some snow days where the health department had been closed and staff couldn't get in. So it caused quite a backlog between the surge and all of those issues that we were facing. So we got behind on reporting, as I said, and that made our numbers a little bit skewed. So as you all were used to seeing certain reports from us or certain reports from the district over the duration of COVID, we had to switch that. And at this point in time, the most reliable data we can provide to you all is the state data that we've been sending out every night. And that's because the state has, early on in the pandemic, a lot of times you may have heard me or Mr. Crabtree or some of the health department staff say that the local data was the most reliable. And it was, because the state didn't have processes in place early on to vet some of the data and get it processed quickly and timely as we did. We were able to do things much more in a real-time manner than the state was. That has improved over the course of the last 2 years with the processes the state has in place. There's electronic reporting now for most of the labs that is available that sends that data directly into the electronic reporting system, which the state can see. So the state numbers are much more real-time than they used to be. So until we can catch up on our backlog of information and cases, we're encouraging and trying to instruct everyone to use the state data. And that's what we're sharing every day. We send that out to our partners through our notification systems. We also have that posted on our webpage. So as of now, all 10 of our counties are still in the red zone, still in a very high incidence of transmission of the disease. It's still there. It's everywhere. It's not in any certain places. It's pretty much everywhere. And having said that, the health department has kind of revamped its efforts. The state sent some guidance out a few weeks ago and said that, at certain points in time, contact tracing definitely has a place when you're trying to limit spread of disease, when it's not widespread in communities and in situations. When a situation like we have where everything is so widespread now, contact tracing is much less useful as a tool to limit spread. So their recommendations are that we do targeted case investigations and quit contacting every single positive case that gets reported. So what we have done is prioritize cases. And so we're looking at every case that gets reported to us. We're looking at those. If it's in a high-risk group, if it's in a congregate setting, if it's in a long-term care situation, if it's, an age group that's at higher risk, if they have, if it's jails, homeless centers, you name it, daycares. schools, those types of settings. That's what we're focusing on, outbreaks in those types of settings where there's large numbers of people closely together for extended periods of time. That's our best focus of efforts right now. And then we are also redoubling our efforts on vaccination, on education for the public, on how they can protect themselves and their families. And as such, we have implemented on our webpage a calculator that you can go in and put your exposure date or the date your symptoms started, and it will then tell you how long you should isolate, what day you should come out of isolation or quarantine, and that. So that is also going to help our public, we hope, in order to know how long they should separate themselves and not be around others. From all that information, we've tried to get that out to the media and share that out. Last week, we did a media brief where we talked to all of our newspaper and radio partners across the region to get that out. So that's kind of the situation with COVID. Of course, that's not the only things we're working on across the district. We have plenty of other irons in the fire, and the normal public health types of situations don't stop, even though COVID is raging. So we have also, done all the normal public health things. We're still doing immunization clinics, just like always. We're doing, WIC and diabetes classes, and Tracy's doing her health education stuff, which she's going to talk about in just a minute. We're working on coalitions across the region, we're trying to do our reaccreditation process. So the health department 5 years ago went through initial accreditation. That was good for 5 years. And so now we are at the point of having to do our reaccreditation. And so we are also looking at all of that type of information on top of everything else. So there's a lot of things going on at the health department. Everyone's staying busy, and it's just never ending. I'm very thankful for our staff that put in so many hours and are willing to wear so many different hats and pivot on a dime. It just seems like we get thrown a different wrinkle and they're right there ready to go. So I appreciate that so much. And as always, if there's anything we can do for you all, if you have issues or concerns in your community, please let me know, and I'm willing to address them and work on local issues any way that I can to help you all. So I'm willing to take questions or comments if you all have anything for me, any way that I can help Cumberland County specifically.
Does anyone have any questions for Amy?
Amy, this is Dr. John Stevenson.
Yes, sir.
Yeah. This might actually be a question for Cindy, though, also. What is the protocol to get a COVID test, here in our county now? I know about 3 weeks ago, if you call the hospital, you had to have a doctor's order. And if you didn't meet a certain criteria of symptoms, I don't think you could get that. So I know that people were just having to go up to Columbia to get a test now. Is that still the way that is? I mean, shouldn't we want a test when people think they need tested?
Sydney may know better than me locally what the situation is. I do know that. I'm sorry, who was talking? I didn't mean to talk over you.
No, that's okay.
I can answer it as far as the hospital part's concerned. It's
Okay.
the lack of test kits is the problem. At the hospital, at the Cumberland County Hospital, you do have to have a doctor's order. We don't turn anybody. We all went there for a day or two. We may have had to turn few people away because we simply run out of kits. And the PCR kits, which are the most accurate, we have almost none. So we save those for people who are very symptomatic with a fever, with other complaints. That's the ones we save for the PCR because we're down to just pennies of them. The actual rapid test, which is less accurate, is the one that we use. But we haven't been turning anybody away that calls the clinic. We do the rapid, like if they need one for work or to return to work, or if they're sick or their kids are sick and they're not in that high risk group or have a lot of symptoms to warrant the PCR test that we have so few of. And we actually ran almost out of the rapid test as well, but we borrowed some from Columbia and some other counties, and we've got some shipments in. But since then, we're pretty much testing anyone who asks. They may just get the rapid test. We haven't in our office anyway sent anyone anyplace else.
So you mean the rapid test one that, goes in 10 minutes or something? Just
Correct.
like you get it, just like you get at CVS.
Yeah, pretty much. The PCR
Okay.
it takes about 45 minutes. It's the one that did take a couple of days in the beginning of COVID, but that's now about a 45-minute test, and it's actually more accurate. But we just don't have enough of the test, and no one else does either. So
That's the PCS test, you said?
PCR.
PCR.
PCR. Oh, that's right, PCR. So do you have to have a doctor's order to get that?
You have to have a doctor's order to get any COVID test in Cumberland County.
Okay, that's just in
But that's
Cumberland
no-
County.
At
Yeah,
the
but that's no
hospital.
problem, Dr. John. I mean, you can just call up there and get the doctor to do it if you think you need it.
Correct.
Like Doug said, we never turn nobody away.
I've never told. We don't know.
Well,
we
no,
don't
that
ever turn
wasn't the way
anybody
it
away,
was
but they
like
have to
3
call
weeks
and
ago.
ask, yeah.
I know people were having to go to Columbia because they just didn't want to go through having to get a doctor's order and go up there. So that's not the case. So,
Well, the doctor's order part's very simple. I mean, we do in our
but if
office.
you call, a lot of times they wouldn't give you one if you didn't meet maybe a certain set of criteria.
Well, there have been supply chain issues, like he was saying. I think that it's hard to get certain tests and even pieces of tests, like the reagents and some of the swabs and different pieces are harder and harder to get. So it could be that they were limiting to symptomatic people. I think he mentioned that also. A lot of places have limited to just the extremely symptomatic across the district. So I think it comes and goes. You know, when we have more tests, then we're able to do more broader groups. And when we have less tests, we have to focus more on symptomatic people. But if that's something that we need to keep a closer eye on, I can certainly, now that we're trying to catch up and we've shifted our focus and things, maybe the health department needs to refocus too and put more effort on keeping up with testing in the communities and seeing where the needs are and how
Yeah,
we can.
maybe, if you just kept us supplied with the PCR test and all that, if you could do that, maybe.
I'll look into what the options are. If there's a local option that where we can use the sources, resources to purchase additional things, or I think it's just a supply chain issue though. I don't think it's necessarily that the hospital's not able to do them. I think we're not able to get them. So I will definitely look into it though, Dr. Stevenson.
Okay. All right. I appreciate that because that was, like I said, that was pretty difficult. People going to Columbia, instead of going up here because they, like I said, they call you had to have a certain criteria. Even though you had symptoms, you had to have, I guess, more severe symptoms to get it. So,
right. The hospital's done a lion's share of testing for Cumberland County. They've done a whale of a job down there keeping the community, tested and safe. I appreciate their efforts. But eventually, somewhere along the line, I think the supply chain's catching up with most of us. We're having a hard time getting supplies everywhere.
All right. Thank you.
But I will look into it, see if there's something else we can do.
All right. Thank you.
You're welcome.
Good
I will say
question.
too that there's one other little wrinkle in this whole COVID thing. That's the at-home testing that's available now. That is not reportable to the local health departments. So if you do an at-home test, it's just a suggestion, basically that you are positive and you need to quarantine, that kind of thing. It's not reportable. It's not even, if you call and tell us or you call any provider, they're going to say you probably need to have a PCR test or another provider administered test to make sure it was done correctly and this kind of thing. Where its value is if people take it to heart and use it as a diagnostic tool for their own selves and then would isolate. If it does good if you do the test and you're negative that day and you go on about your business, even though you feel bad, you go on about your business and you expose a bunch of people, or you do the test and you're positive and you just ignore it and you think, well, it's probably a false positive, whatever, and you go about your business. So if you're going to do them, you need to follow the criteria to do them also. But that's another wrinkle that has come up recently, the at-home testing. The federal government has supplied those kits to people. You can request those on the federal government's webpage. We have a link, I think, for that on our webpage. Every household could order 4 free at-home kits. And I ordered those for my household personally. And it took just a little over a week to come in the mail, and it was delivered to my doorstep. And I've actually already used one of them. So it worked just fine. So that's available. The federal government is also making a requirement so that insurance providers and like FSA, flexible spending accounts and different things like that will have to reimburse the cost of those at-home tests when you go buy one at a pharmacy or Walgreens or CVS or Kroger's or whatever. It will reimburse that cost to that person. It's a covered cost now for that. So that's another resource. But like I said, those are not reportable numbers. So even as high as the numbers are that the health department is reporting and the state is reporting, people that are doing the at-home test, that doesn't even include those. So just know that there is a lot of sickness out there everywhere, and it's not limited to one location. It's not limited to schools or nursing homes or jails or whatever. It's everywhere, and we're doing our very best to keep tabs on it. But it's beyond our control at this point. It's gotten away from control measures, and it's up to every individual person now to protect themselves and do the right thing. Vaccinations are still protective as far as hospitalizations and severe illness. So that's where we want to focus efforts and kind of push people towards. But, the boost, the more recent you've had a boost, the more likely you are not to have serious illness and infection. So if you've had your first and second shots, but they were last year, and then it's been a year and you never got your boost, you're still at risk. And our medical director explained all this on our media brief last week, which is on our YouTube page for the health department. You can go back and watch or listen if you're interested. But her advice to everyone is to get boosted, and to get boosted as soon as possible to protect yourselves. I'm sorry, I took much longer on that than I meant to, Judge.
Oh, that's fine. That's fine. I think we've had some good questions and good dialogue there. I think that all was very well. Does anybody have any more questions for Amy? Okay, hearing none. Thank you, Amy. Amy's stepped right into the role when Director Crabtree retired, and she has done an outstanding job, and proud of the job that she's doing. We've got great folks with our health department locally and all across the Lake Cumberland region, and appreciative of the job that everybody's doing. Health education.
Good
Tracy.
evening. This is Tracy Aaron. I work at the district office. I'm the health education director, and I just wanted to share a couple of updates that's happening within our department. Amy shared a few minutes ago, in January, we have started working in health education again. We are doing some community programs virtually in our schools and across the communities. Right now, again, we are doing those virtual. Amy talked about accreditation. We are working on our community health improvement plan and the community health assessment. Actually, I have just been updating our community health assessment, and that will be updated on our website by the 21st. As I look through Cumberland County data, really our health behaviors have improved a little bit across over the year. But it looks like your population decreased about 2.5% or a little over 2%. Some of the other measures I was looking at really remain the same. There was not pretty similar, I guess, as I should say, when I looked at the quality of life and some of the health outcomes, which is good. But I want to say all that information will be on our website. I encourage you all to look at the new data on our website. We have a wealth of data on the district website. We are going to start working on the community health improvement plans, which is a part of accreditation, but it's also a means where the community partners come together and look at the data and determine the health issues that they want to work on in their community. And in 2019, within the coalition, the priority health issues was that they identified to work on was chronic disease and substance use. So my plans are to come back together with that group in the next month and see how we want to move forward with our action plan addressing those in Cumberland County, Burkesville. And that's pretty much all that I have to share, Judge Phelps.
Thank you, Tracy. Does anyone have any questions for Tracy? Okay, good. Thanks again, Tracy, for that report. Diabetes.
I don't think we have anybody on for that. Judge, it was going to be spotty on when they can and can't get on these meetings, but they are on the last 2 pages of the board packet for the diabetes report. If somebody wants to view them in their own free time.
Okay, there's some information on the education and population resources at the back of your packet, is Ron brought to our attention, and for your leisure. That completes everything on our agenda. I appreciate everybody taking the time to be on, and very important. I know we only have this board meeting once unless we have something come up in the event for a special call, but appreciate everyone very much and your dedication to the health department. And that I will accept a motion to adjourn.
Motion adjourned.
Motion by Gary White. Is there a second?
Second.
Second by Christian Brownell. All in favor signify by saying aye.
Aye.
Hi.
All opposed? Motion carries. Everyone have a wonderful evening. Thank you all.
Thank you.
Bye.
Bye-bye.